Hello, I'm Dr. Suzy Press, a participating Delta Dental pediatric dentist and a proud mother of 4. Today I'm here to discuss the use of pacifiers and thumb sucking and its impact on your child's oral health. I know it's hard to tell whether your baby is crying from hunger, teething, or something else. To soothe your baby, you hold him, gently rock him, sing or read to him, feed him, or sometimes let him suck on a pacifier or his thumb. And you worry, will the pacifier or thumb cause the teeth to grow crooked? Is this best for my baby? According to the American Dental Association, thumb sucking is a natural reflex which instinctively soothes anxiety. Don't worry during the infant and toddler stages. However, there is a consensus that if the habit persists after the permanent teeth arrive, around age 6, there may be problems with proper growth of the mouth or teeth alignment. So you also wonder, are pacifiers a better choice? Studies show that they will soothe, distract, and help your baby fall asleep. In fact, the American Academy of Pediatrics recommends that parents offer pacifiers to infants 1 month and older when they're about to fall asleep to reduce the risk of sudden infant death syndrome. But studies also show that prolonged use of pacifiers could come with certain risks. Early pacifier use might interfere with how long your baby is willing to breastfeed. There also may be a greater risk for middle ear infections if pacifiers are used beyond 6 months of age. Prolonged pacifier use might also lead to dental problems such as an open bite, cross bite, or overbite, particularly when used beyond 2 or 3 years of age. It also depends on how often children use pacifiers and for how long. Adverse dental effects can appear after 2 years of pacifier use, but are more likely to show up after a child is 4. The American Academy of Family Physicians recommends that mothers be educated about pacifier use to avoid difficulties with breastfeeding. They and the American Academy of Pediatrics recommend weaning children from pacifiers in the second 6 months of life to prevent ear infections. Although both a pacifier and a thumb will help a fussy baby in the short term, the key is to use them with caution and introduce other substitutions when the time is right. The bottom line is that pacifier use might be especially beneficial in the first 6 months of life and should not be actively discouraged until it presents a risk. Follow these tips when introducing a pacifier to your child. Introduce a pacifier after breastfeeding is established. Don't use it as a first line of defense, or offer it if it is not needed. Try a gentle rocking session and only offer the pacifier after or between feedings. Choose a silicone one-piece dishwasher-safe variety. Keep it clean. Until your baby is 6 months, boil or run it through the dishwasher. After that, wash it with soap and water, but don't rinse it in your mouth. Don't dip the pacifier in sweet substances. Replace it often, using an appropriate pacifier size, and watch for loose parts and signs of deterioration. Remember, whichever solution you choose, monitor your child carefully and plan to wean him between 6 and 12 months. Here are some age-appropriate weaning tips. Try singing or playing soft music for an infant. Introduce toys or a favorite blanket for toddlers as a distraction. And for older children, try a special ceremony to discard the pacifier with a book or a toy as a replacement. Breaking the pacifier habit is not easy, but with these steps, you can help your child on the road to good oral health, and that's something to smile about. This Dental Connections video series is designed to emphasize the relationship between oral and overall health. It is brought to you by Delta Dental of New Jersey, New Jersey's leading dental benefits company, and its foundation.